12 worst side effects of lisinopril you should never ignore. Stop taking lisinopril immediately if you are experiencing this symptom. It could save your life. What you're about to discover will change everything you thought you knew about this common blood pressure medication. There are 12 side effects that pharmaceutical companies are required to mention, but most people never connect their symptoms to their medication. Side effect number 3 is so commonly ignored that it leads to emergency room visits for 10% of long-term users. And it could be happening to you right now without you realizing it. Lisinopril is currently the second most prescribed medication in America, with over 100 million prescriptions dispensed annually. That's roughly 1 in 4 adults over 40 taking this drug. While it's incredibly effective at lowering blood pressure and protecting the kidneys, the latest pharmaceutical surveillance data shows that adverse reactions are reported in 1 out of every 5 users. Even more concerning, research indicates that for every reported side effect, approximately 10 cases go unreported because patients don't recognize the connection. Before we continue, let me be crystal clear. This video is not telling you to stop taking your medication. That would be dangerous and irresponsible. Some viewers might think all medications are toxic and should be avoided, while others believe that widely prescribed drugs are completely harmless. Both extremes are wrong. Disclaimer: this video is for educational purposes only and is not a substitute for professional medical advice. If you are unsure about your condition, please consult a healthcare professional or contact emergency services. Let's go through the 12 key warning signs, starting with one of the most common reactions reported by long-term users. Number 1. The nagging, persistent cough, more than just a tickle. We start with one of the most common, yet frequently misunderstood, side effects of lisinopril: a persistent, dry cough. You might think it's just allergies, a lingering cold, but if you're taking lisinopril, there's a good chance your medication is the reason behind it. This cough is typically described as dry, meaning you're not coughing up any mucus or phlegm. It often feels like a tickle in your throat and can be quite irritating, sometimes even keeping you up at night. So why does lisinopril cause this? Let's simplify the science. Lisinopril works by blocking a substance in your body called an ACE enzyme, known as angiotensin-converting enzyme. This is great for lowering blood pressure. However, this same enzyme is also involved in breaking down another substance called bradykinin. When lisinopril stops the ACE enzyme from doing its job, bradykinin levels can build up in your lungs and airways. Think of bradykinin as an irritant. When it accumulates, it tickles your throat and triggers that dry cough. This cough can develop days, weeks, or even months after you start taking lisinopril. It affects about 5% to 20% of people on ACE inhibitors, meaning up to 1 in 5 users could experience it. It's often worse at night or when lying down, and it doesn't respond to typical cough medicines. Many people suffer for months thinking something else is wrong, when a simple medication change could provide relief. If you have a new, persistent, dry cough and take lisinopril, talk to your doctor. They might switch you to a different type of blood pressure medication that doesn't cause this particular side effect. Number 2 is angioedema, the swelling that can be life-threatening. Now we come to a side effect that demands your immediate and undivided attention. This is the one symptom we mentioned in the beginning. If you experience this, you must stop taking lisinopril immediately and seek emergency medical help. It's called angioedema, and it's a potentially life-threatening allergic-like reaction. Angioedema is characterized by rapid, often dramatic swelling. Unlike a typical allergic reaction that might cause hives or a surface rash, angioedema causes swelling in the deeper layers of your skin and the moist linings of mucous membranes of your body. The most dangerous places for this swelling to occur are your face, lips, tongue, and throat. Imagine your tongue or lips swelling so much that they feel stiff, firm, and block your ability to breathe or swallow. That's angioedema. This swelling happens for a similar reason to the cough, but on a much more severe scale. The buildup of bradykinin we just discussed can, in some sensitive individuals, trigger this extreme fluid accumulation. It can start within minutes to hours of taking the medication, but it can also occur months or even years later, making it unpredictable. The swelling usually appears unevenly and feels firm or woody to the touch, not soft and squishy like typical water retention. Here's why this is an emergency. If the swelling affects your throat or airway, it can quickly cut off your ability to breathe. This is a medical crisis that requires immediate treatment. You might find it hard to speak, swallow, or catch your breath. If you ever experience rapid swelling of your face, lips, tongue, or throat while taking lisinopril, do not hesitate. Call emergency services like 911 or get to the nearest emergency room immediately. Early detection and treatment are crucial to prevent a fatal outcome. Number 3 is kidney problems. Lisinopril is often prescribed to protect the kidneys, especially in people with diabetes or certain heart conditions. It can be a real benefit in this regard. However, it can also cause kidney problems in some individuals, particularly those who already have underlying kidney issues or are at risk. This is a critical side effect to understand because kidney damage can often be silent, meaning you might not feel symptoms until significant damage has occurred. How does lisinopril affect the kidneys? It primarily works by relaxing the blood vessels that supply blood to your kidneys, which helps to reduce pressure within these delicate filtering organs. This can be good, but in some cases, especially if your kidneys are already struggling, this reduction in pressure can actually reduce blood flow too much, stressing the kidneys and impairing their ability to filter waste from your blood. This risk is higher in people who already have some degree of kidney disease, have narrowing of the kidney arteries, renal artery stenosis, are severely dehydrated, for example, from vomiting, diarrhea, or strong diuretics, water pills, have severe heart failure. Symptoms of worsening kidney function can be vague and appear gradually. They might include feeling unusually tired or weak, swelling in your legs, ankles, or feet, different from the angioedema we just discussed, less frequent urination or changes in urine color, nausea, loss of appetite, confusion or difficulty concentrating. Your doctor should monitor your kidney function with simple blood tests like creatinine and GFR when you start lisinopril and periodically afterward. If these tests show a decline, your doctor might need to adjust your dose or switch your medication. It's a reminder that even when a drug is meant to help an organ, it can sometimes have unintended consequences. Number 4 is severe lightheadedness and dizziness, the fall risk. Lisinopril's entire job is to lower your blood pressure, and while that's the goal, sometimes it does its job too well, or your body reacts strongly, leading to dangerously low blood pressure. The medical term for this is hypotension, and its main symptoms are severe lightheadedness and dizziness, especially when you change positions. Picture this: you're lying down or sitting, and then you quickly stand up to answer the phone. Suddenly, the room spins, your vision tunnels, and you feel like you might faint. This sensation is called orthostatic or postural hypotension. It happens because when you stand up, gravity pulls blood downward, and your body needs to quickly narrow blood vessels and increase your heart rate to push blood back up to your brain. Lisinopril, by design, interferes with this rapid response, keeping the blood vessels relaxed. This means your brain doesn't get enough blood for a brief moment, leading to that dizzy spell. For younger, healthier people, this might just be an uncomfortable moment. But for the elderly, or those with balance issues, this lightheadedness is a major fall risk. A serious fall can lead to broken bones, head trauma, and a significant decline in health. This side effect is more likely to occur when you first start taking lisinopril, or after a dose increase. If you're taking other medications that also lower blood pressure, like diuretics or other heart drugs. If you are dehydrated or have been sick with vomiting or diarrhea. What you can do. If you feel dizzy, don't rush. Learn to stand up slowly and pause for a moment before walking. If the dizziness is severe, frequent, or leads to fainting, you must talk to your doctor immediately. This often means your dosage is too high and needs to be adjusted. 5. Unexplained fatigue and weakness, the energy drain. Do you feel constantly tired, even after a full night's sleep? Have simple daily tasks started feeling like a huge effort? Many people on lisinopril report a pervasive, unexplained feeling of fatigue and general weakness. This isn't just regular tiredness, it's a deep, energy-draining sensation that impacts your quality of life. While lisinopril is meant to improve your heart health, and therefore your overall energy, in some cases, the mechanisms that lower blood pressure can contribute to this fatigue. When blood pressure is lowered, even if it's for the best, the overall force pushing blood and oxygen throughout your body, including your muscles, is reduced. If your body isn't getting adequate blood flow and oxygen to meet the energy demands of your cells, you'll feel tired. Furthermore, Some research suggests that the fatigue might be related to how lisinopril affects certain chemicals in the brain that regulate energy and mood. This fatigue is often overlooked because fatigue is a common symptom of many conditions, from stress and poor sleep to heart failure itself. Patients assume, well, I'm just getting older, or I'm busy. The connection is key. If you started lisinopril and shortly after noticed a significant new level of tiredness that doesn't go away, it's worth exploring the medication as the root cause. Don't simply accept being tired as your new normal. Discuss this persistent fatigue with your doctor, as a dose change could restore your energy levels. 6. Changes in taste. The food that tastes like cardboard. Imagine your favorite meal. Now imagine eating it, and it tastes completely different, or worse, it tastes like nothing at all. This is a side effect known as dysgeusia, or an alteration in taste, and in some severe cases, complete loss of taste, known as ageusia. Lisinopril can sometimes disrupt the delicate chemical balance required for your taste buds to function correctly. Patients often describe a persistent, metallic, bitter, or salty taste in their mouth, even when they haven't eaten anything. For others, food becomes bland or flavorless. Studies show this side effect is relatively rare, but incredibly distressing for those who experience it. The good news is that if taste changes are linked to lisinopril, they usually disappear once the medication is stopped. If you've noticed a significant change in how food tastes since starting lisinopril, and it's affecting your enjoyment of life or your eating habits, bring it up with your healthcare provider. Number 7 is hyperkalemia, dangerously high potassium levels, the silent heart threat. This is side effect number 7, and it's a perfect example of a silent danger that often goes unnoticed until it triggers a serious medical event, like an emergency room visit. The term is hyperkalemia, which simply means having dangerously high levels of potassium in your blood. Now, why is this so important? Potassium is an essential mineral. It's critical for keeping your heart muscle and your nerves working correctly. But like a seesaw, you need the right balance. Too little is bad, and too much is just as dangerous. Lisinopril, as an ACE inhibitor, has a known effect on how your kidneys manage salt and water. And as a byproduct, it can cause your body to hold on to potassium instead of letting it pass into your urine. Think of the kidneys as the ultimate filter and regulator. Lisinopril subtly tweaks that regulator, causing a buildup of potassium. This side effect is especially risky for people with reduced kidney function, people taking potassium-sparing diuretics like spironolactone or potassium supplements, elderly patients whose body systems naturally become less efficient at regulating minerals. Mild hyperkalemia often has no symptoms, but as potassium levels climb, they can disrupt the electrical signals that regulate your heartbeat, leading to dangerous and irregular heart rhythms, arrhythmias. In severe cases, this can be fatal. The symptoms to watch for, if it gets serious. Since this condition is usually silent, the most common way it's caught is via routine blood tests, which is why regular monitoring is crucial. However, if levels spike, you might experience muscle weakness or numbness, nausea or vomiting, slow, weak, or irregular pulse. This is the side effect often missed until a trip to the ER due to an irregular heartbeat. You should discuss your diet, high potassium foods like bananas or oranges, and any supplements you take with your doctor, as they may need to adjust your lisinopril dose or your other medications. Number 8 is severe hypotension, fainting spells. We touched on dizziness, but this is the severe, dangerous version. Severe hypotension leading to fainting, or what doctors call syncope. This isn't just a brief dizzy spell. This is a temporary, complete loss of consciousness. Remember, lisinopril is a powerful blood pressure lowering agent. In some people, particularly when the dosage is too high, or if they take it while dehydrated, the drop in blood pressure can be so rapid and severe that the brain is starved of oxygen for a few moments, causing a blackout. Fainting itself is an involuntary way your body tries to fix the problem. When you collapse, you become horizontal, and gravity is no longer fighting the blood flow to your brain. The real danger of syncope isn't the fainting itself, but the injury that occurs during the fall. People break hips, wrists, and sustain serious head trauma when they lose consciousness suddenly. This is a primary driver of hospitalization among new users of blood pressure medication. If you faint, or feel you are constantly on the verge of fainting, you must tell your doctor right away. This often necessitates a reduction in dose, a change in medication, or a serious look at all other drugs you are taking. Don't dismiss a fainting spell as a fluke. Number 9 is skin rashes, from mild to malignant. Lisinopril, like many medications, can trigger various skin reactions. These can range from a simple, bothersome rash to an extremely rare but potentially life-threatening emergency. The most common reaction is a maculopapular rash, which looks like flat red spots mixed with raised bumps, usually appearing on the trunk, arms, and legs. It's often itchy and annoying, and it may resolve on its own or with the help of antihistamines, but it means your body is reacting to the drug. In extremely rare instances, lisinopril can trigger severe allergic reactions known as Stevens-Johnson syndrome, SJS, or toxic epidermal necrolysis, TEN. These are true medical emergencies. They start with flu-like symptoms, followed by a painful red or purple rash that spreads and blisters, causing the top layer of skin to peel off in large sheets, much like a severe burn. Warning signs of SJS-TEN: fever and flu-like symptoms, widespread painful skin rash that starts to blister, sores in your mouth, nose, eyes, or genital area. If you develop a rash that is painful, spreading quickly, or involves blisters and sores, seek emergency medical attention immediately. These conditions require specialized care and prompt discontinuation of the offending drug. Number 10 is severe gastrointestinal distress, pain and diarrhea. While lisinopril is swallowed and acts in your bloodstream, it can cause severe turmoil in your digestive system, leading to significant gastrointestinal distress. The most common symptoms are severe persistent diarrhea, nausea, and intense abdominal pain. Why does this happen? The ACE enzyme that lisinopril blocks is present throughout your body, including in your gut. Disrupting this enzyme activity and the resulting buildup of bradykinin we discussed can cause irritation and swelling in the intestinal walls. This swelling can lead to rapid fluid changes and muscle contractions, resulting in painful cramping and watery diarrhea. For some people, this is a minor issue that fades after a few days. But for others, the diarrhea can be severe and persistent, leading to dehydration, electrolyte imbalance, and weight loss. Imagine dealing with chronic stomach pain and sudden bathroom urgency. It completely disrupts your life, forcing you to constantly worry about finding a restroom. 11. Mood swings, anxiety, and depression, the mental fog. This side effect is perhaps the most difficult to attribute to a pill, but studies and patient reports have clearly established a link. Lisinopril can sometimes trigger or worsen mood swings, anxiety, and depression. How can a blood pressure pill affect your mood? The ACE enzyme is not just in your blood vessels. It's also involved in regulating certain chemical pathways in your brain that affect mood and stress response. When lisinopril interacts with these brain chemicals, it can disrupt the delicate balance that keeps your mood stable. Patients on lisinopril have reported a range of psychological symptoms: increased anxiety, sudden, unexplained nervousness, persistent worry, or even panic attacks. Insomnia, trouble falling or staying asleep, leading to chronic tiredness and irritability. Irritability and mood swings, feeling easily frustrated or noticing rapid shifts in your emotional state. These symptoms are often simply labeled as stress or age-related issues, leading patients to be prescribed an additional medication, an antidepressant or an anti-anxiety drug, instead of addressing the root cause. Maybe it's the lisinopril itself. If you notice a significant, new change in your emotional state shortly after starting or changing the dose of lisinopril, you must talk to your doctor. It is essential to explore whether the medication is the underlying driver of your mental health struggle. Number 12 is headache. And finally, we arrive at side effect number 12. This one affects a significant portion of users, and when we factor in people who get headaches and experience the fatigue and dizziness we discussed earlier, we see why this symptom is part of the 1 in 3 users statistic teased at the beginning. This is the headache. While the cough is the most specific side effect of ACE inhibitors, the headache is arguably the most common and disruptive, affecting anywhere from 5% to over 10% of users. Lisinopril works by dilating your blood vessels to lower pressure. This is good for your heart, but sometimes this rapid widening, especially of the blood vessels in your brain, can cause pain. It's a bit like suddenly releasing the pressure on a tight hose. The walls of the vessel stretch, and this stretching is interpreted by your body as a headache. These headaches are often described as dull and throbbing, generalized, not focused on one spot. Worse during the initial weeks of starting the medication or increasing the dose. The key difference here is the context. If you've never regularly suffered from headaches, and you start taking lisinopril and develop a new, persistent headache that doesn't respond to over-the-counter pain relievers, the connection is clear. If this symptom is paired with the fatigue and mild dizziness, it can severely diminish your quality of life. Persistent headaches are often a sign that your body is having trouble adjusting to the drug or that the dose is slightly too high. Working with your doctor to either adjust the dose or try a different class of blood pressure medication can usually resolve this annoying and painful side effect. We have just exposed 12 of the most critical side effects of lisinopril, from the life-threatening swelling of angioedema to the silent heart threat of high potassium to the persistent discomfort of cough and headache. The main takeaway from this video is awareness. Lisinopril is a powerful, life-saving medication for millions, but like any powerful tool, it requires respect and vigilance. Remember these 3 critical steps. 1. Know the emergency signs, the non-negotiables. If you experience angioedema, rapid, firm swelling of the face, lips, tongue, or throat, stop taking lisinopril immediately and call emergency services. 911, emergency number. Do not wait. This is a life or death situation. Likewise, if you develop a blistering, painful, or peeling rash, SJS/TEN, seek emergency care. 2. Demand regular monitoring, the hidden threat. Because side effects like hyperkalemia, high potassium, and worsening kidney function are often silent, you must be proactive. When you see your doctor, ask them, "Have we checked my blood potassium and kidney function recently?" Routine blood work is your defense against these invisible dangers. 3. Communicate everything, the quality of life. Do not let yourself be dismissed. If you have a persistent dry cough, unexplained fatigue, severe dizziness, or a new struggle with anxiety or depression that started after taking lisinopril, you have the right to investigate. Use the knowledge from this video to have an informed conversation with your healthcare provider. Your goal is not just to lower your blood pressure, but to maintain the highest possible quality of life while doing it. This information is for educational purposes only and is not medical advice. Consult your healthcare professional before making any changes to your medication schedule. Was this helpful? Don't let this knowledge sit idle. Give it a like. Share this video with someone you know who takes lisinopril. It could be the warning they desperately need. And subscribe for more vital health information that pharmaceutical companies rarely focus on. We empower you with knowledge. Stay informed, stay safe.